Classification of joints regarding structure and function. Joints are points where two or more bones meet, allowing movement. Joints are classified depending on their structure and function. Fibrous joints are bones connected by dense connective tissue with no joint cavity. Fibrous joints are immovable or have limited movement. There are three main types of fibrous joints. The suture in the skull hold the bones together, which protects the brain. In the syndesmosis joints, the bones are connected by ligaments, like the distal joint between the tibia and the fibula in the leg. Omphosis secures their teeth into their sockets. Cartilaginous joints are bones connected by cartilage with no joint cavity. These joints allow limited to no movement. There are two kinds of cartilaginous joints: the synchondrosis and the symphysis. The synchondrosis joint is joined by hyaline cartilage. An example of this is the epiphyseal plate, which allows bone growth and development. And the symphysis is slightly movable and connected by fibrocartilage. An example of this is the intervertebral disc in the spine. The synovial joints are the most common and versatile kind of joint. These bones have a joint cavity filled with synovial fluid, allowing free movement. There are 6 kinds of synovial joints. Hinge joints allow movement in one plane, like opening and closing a door. An example of this would be an elbow. The ball and socket joints allow movement and rotation in multiple directions. An example of this is the shoulder and hip. Pivot joints enable head rotation. Example of this is the joints between the first and second cervical vertebrae. The condyle joint allow movement in 2 planes, side-to-side motion. An example of this is the wrist. Saddle joints in the thumb, enabling a wide range of motion for grasping, and the plane joints allow gliding movement in the small bones in the wrist.